The first bill that we have is Chair Cliven's bill, that is House File 3935. I move that House File 3935 be laid over for possible inclusion. With that, members, we have an A1 amendment. Chair Cliven, do you want to explain the A1 amendment?
Yes, Mr. Chair. The A1 amendment does some important things based on conversations we've had with MDH, first responders, the providers, and elder advocates. The A1 now makes a response person-centered. We clarified emergency by saying that we were talking about medical emergencies. We've confined the bill to 5 common events that occur in assisted living, and we made notification to clients based on changes in policy. And another important thing is that we removed the fine, which was difficult.
Thank you so much for that explanation. Any member discussion on A1 amendment? Seeing none, all those in favor, please say aye. Aye. Opposed? The A1 amendment is now adopted. To your bill as amended, Chair Cliven.
Thank you, Mr. Chair. I would just like to say that this bill is at the very heart of what it means to be a representative. A neighbor of mine called me to alert me of the fact that her father had died in an assisted living facility in the neighboring community. Larry, who was a 79-year-old, fell off of his electric scooter. His neck was pinned against the wall, and instead of receiving assistance from the attendants who were in the room, he slowly suffocated. Larry would have celebrated his 80th birthday last week. So this bill focuses on 2 things. It focuses on facility policy and procedure requirements, and it focuses on training requirements of unlicensed personnel. I've heard from numerous first responders that they spend a great deal of time responding to 911 calls to assisted living facilities for non-emergency and emergency events. And we have heard that in Illinois, Nebraska, and Wisconsin, they are also working to change this no lift, no touch policy. While the policy is well intended to protect the health and well-being of workers, it neglects the fact that individuals who are there may suffer grievous bodily harm when no injury could have resulted if they would have been assisted. So this is a very human-centered. It matches the consumer expectation that when a family member goes to assisted living, that there will in fact be assistance when they have a minor medical emergency, or it could be a major medical emergency as well. But they expect more than a 911 call and having their loved one laying on the floor while waiting for those responders to attend. And that is at the very heart of the bill. We're happy to answer any questions that you may have.
Thank you for introducing the bill. We have testifiers. Please, welcome to the committee. Please introduce yourself and proceed.
Okay. Christine Sundberg will come and testify if you'd like.
Ms. Sundberg, welcome to the committee, and please proceed with your testimony.
Okay. My constituent is on their way, but they've not yet arrived. So, but it's okay. Please go ahead.
Thank you, Chair and members of the committee. I'm Chris Sundberg from Elder Voice Advocates. Our advocate daughter, who is on her way here, got lost in our complex, so she'll be here shortly to tell her own story. But we've worked hard with the industry folks to try to accommodate their issues as well as the agency people, and I think we have a much improved bill. With that, I will turn it back over.
Thank you so much. And I do have Susie Scheller here, who is a lawyer who can answer technical questions if members have those as well.
Thank you so much. I know we have 2 testifiers who want to testify on this bill, the long-term care and palliative team. maybe we can pull an extra chair there.
You can stay, we'll just slide over.
Mr. Burnt and Ms. Hubert, please welcome to the committee and introduce yourself.
Thank you, Mr. Chair and members of the committee. My name is Kyle Burnt. I'm here today on behalf of the Long-Term Care Imperative. We appreciate the author's attention to resident safety. As you heard, we had an opportunity to meet with advocates on Friday to discuss the proposal, and we agree that residents should receive timely and appropriate responses during emergencies. And our providers take that responsibility seriously. The A1 amendment adopted by the committee does address some of our concerns. I think that that's fair to say, but it does raise some new ones. For example, the requirement of an on-site EMR, which is defined under 144E.27. I'm not an expert in that arena, but we are unsure if facilities would be able to meet this requirement, and we're not sure if the workforce exists to meet that. We will continue the conversations with advocates and the author as we try to understand a little bit of this redesign proposal. And I'll turn it over to my colleague to finish.
Ms. Hubert, welcome to the committee. Please introduce yourself and proceed.
Yes. Good morning, Mr. Chair, members of the committee. For the record, my name is Erin Hubert, and I'm also here on behalf of the Long-Term Care Imperative. And I think what I will just say is the event that brought this issue before the committee was a tragedy, and it certainly does not reflect what anyone wants to happen when loved ones are put in someone else's care. Beyond the proposal itself, it has served a really important role in reaffirming and establishing best practices in staff training and medical emergencies that may occur in assisted living communities. And both of our respective associations have been taking appropriate steps to reassert those best practices with our members. We also would like to thank Representative Cleavorn for working with us, and we'll continue to do that moving forward. Thank you for the opportunity to testify.
Thank you so much for your testimony. Do we have anyone else in the public who wants to testify on this bill? We can move to member discussion. We'll give
That's okay.
your constituent the time when they're
Thank you.
Members, any discussion? Representative Barker.
Yeah, thank you, Chair, and thank you, Representative. So how will the department monitor that this policy is actually fulfilled?
Check Lever.
I mean, I should be more specific. What compliance will they have to do to make sure, compliance check that if this comes into law, that this is actually being followed?
Please introduce yourself and proceed with your testimony on that.
Yes, my name is Suzanne Scheller. I'm the legal advisor for Elder Voice Advocates, and I'm here just for some technical assistance on the bill. Chair Noor, I apologize, I can't quite.
Represent background.
Representative,
fine.
thank you.
You can call me Baker.
We never call you back.
We'll call you by your appropriate name. Yes.
Michelle.
Representative Baker.
Backer.
Sorry, we'll get it right if I could.
See
But
what
in any
you've done
case,
there.
I see that. Okay. Sorry, Chair.
Thank you, Representative Barker. Michelle.
thank you, Chair Noor, and Representative Backer. All right. So what we anticipate is because these provisions are in several different places in the assisted living statute, one is in the minimum requirements for an assisted living facility. It's also in the training requirements and the policies and procedures. So 3 different places. What we anticipate is when there are the surveys by the Minnesota Department of Health, when they're looking at that, they would be looking at, are these policies and procedures in place? And so we would be anticipating it would be during those regular surveys that would be determined, particularly because of where they exist in the statute.
Okay. And thank you, Chair. Next question is what type of costs are we looking at for the assistant facilities and so forth?
Michelle.
Mr. Chair, I
Check
did.
Lever.
Thank you. I did do some research prior to coming here, and this recommendation came from first responders. It is a 40-hour requirement for individuals. It can easily be done online. It is advertised as do this in 1 week. The module costs about $895 and I only looked at providers that are listed on the Minnesota Department of Commerce website.
Representative Barker.
Okay, thank you. So another question. So are you saying what you're looking for? Because there's two ways to fulfill this model. And of course, I'm thinking of a assisted living not too far from where I'm at, which you could get someone to be an EMR, but that ambulance service, and it's not Browns Alley, but that ambulance service has trouble with EMRs and EMTs during the day already, okay? So, of course, one model would be that they would hire someone that's an EMR and be at the facility, or are you thinking about that one of the staff people would then be required to get EMR training?
Mr. Chair.
Madam Chair.
Thank you. Mr. Chair and Representative Backer, it is my understanding through talking with first responders currently that it could be a member of the staff that already works for the facility, so that additional staff would not need to be hired, but additional staff would need to be trained.
Representative Barker.
No further questions, thank you.
Representative Hicks.
Thank you so much, Chair. Thank you so much, Representative Cleaborn, for bringing this bill. This might be a question for the imperative, but something that the tragic story that you told and that I saw in the media brought to my attention was, from my understanding, and someone can correct me if I'm wrong, but people are paying quite a bit of money to live in assisted living for more than just a 911 button. If the response to a minor emergency is a 911 button, I don't know why we're spending tons of personal dollars or taxpayer dollars in an assisted living. And so I was shocked because in the disability community, we do pick people up. That is what we do in 245D. And so I was not aware of this concern. So perhaps you or one of your testifiers could tell me how prominent, you said you spoke to first responders, how prominent is this problem? Because again, in the disability community, we assume that we will lift people if they fall down.
Chair Cleaver.
Thank you, Representative Hicks. I will say that it has been significant enough that the community of Maple Plain has in fact passed an ordinance saying that they will now start charging for these calls, especially when they're non-emergency. I believe what you're talking about is so important, and the reason I really wanted to carry this bill is the expectation of the general public is that when the word assisted living is used, that their family members will in fact receive assistance when something like a non-emergency fall occurs. And I will ask Ms. Scheller if she has more to say about this.
Ms. Scheller.
Yes, thank you, Chair Noor. Thank you, Representative Hicks, for the comment and question. I wanted to highlight two things relative to your question. One of the things the language in the bill is trying to do is distinguish that emergency from non-emergency, because no one disagrees that 911 and emergency services are appropriate in that emergency. But because the current status is to blanket both non-emergencies and emergencies under the no lift, no touch policy, we are asking for distinguishing between those two, having some basic training to address the emergency. No one is saying don't call 911, but we're also hearing that there is non-emergency situations in which someone could be assisted, and 911 might still be called. So it's really trying to address two things. To your question of the prevalence of it, I would say that as elder voice advocates, it's a frequent call. Quantifying the number of individuals that this affects is difficult, but it's rising to this level because there is an assumption or an expectation that when someone enters the facility, they would have some basic care, because that's really the number one reason they're going in there. Often family members are concerned of an emergency event happening at home where no one can see that. And so a big reason they're seeking entrance to the facility and admission is to be able to accommodate or address those situations when they occur, whether it's a non-emergency fall and needing just some assistance getting up, or it's an emergency situation that needs critical care. So one of the pieces of the bill is that notification requirement. We are saying people should be aware from a consumer transparency analysis. They should be aware as a prospective resident what the facility would be doing, what is the expectation. Because many of the contracts have provisions that allow proactively the facility to call 911 on behalf of the resident. So when they're seeing that language potentially in the contract, there is again an expectation that there would be some assistance in an emergency. So we're looking at that transparency piece as well in this bill. So thank you.
Representative Gand.
Thank you, Mr. Chair. In my former life, I served as mayor in East Grand Forks, and I know that our firefighters were pretty honored to go over to the assisted living facility and help lift residents. I would hope that, the outcome of this proposed legislation would somehow, we would triage and identify, is there an imminent emergency, right? Is there a risk of a worsening condition without quick lift, as you say, an obstructed airway or bleeding, various things. So I would hope that there would still be a provision where it would be very easy to bring those firefighters in. Again, they're honored. These are like their grandmas and grandpas, and they're honored to come over and help out and assist. So I hope this would not in any way preclude that from happening. Go ahead.
Chair Cleveland.
I agree with you 100%, right? We definitely want 911 called during an emergency situation, and therein lies the need for the training to help the staff, someone on duty 24/7 to be able to identify, is this non-emergency, is this emergency? I agree with you 100%.
Very good. Thank you, Mr. Chair.
The last one will be Representative Murphy, and then we have the testifier here.
Mr. Chair, the testifier,
Yep, after
thank you.
the question from, yeah.
Thank you, Mr. Chair. Thank you. My question has to do with just whether or not you've had conversations with assisted living providers, especially rural, with regard to the cost and the expectation of having 24-hour EMS services available. What were the conversations with them like?
Chair Cleveland.
Mr. Chair and Representative Murphy, your question is a very good one and one that has weighed on me heavily. And that's why it's so important that existing staff be trained. Because we do know that recruiting new staff, retaining staff is a difficult situation. I also serve on higher ed. And it is something that I think we need to consider with the workforce. But understand, there is no free in this equation. Somebody is going to pay the price for the injury, right? So in this tragic event that has occurred with my constituent's family, they have paid a tremendous price, right? And in speaking with first responders, they tell me that this training is very simple to do. They have absolutely no concern that current staff can be easily trained. So it is weighing, the benefit, and the benefit is saving a life. It's really important. Thank you.
Mr. Chair, thank you. My biggest concern is making sure we don't drive providers out. We already give them lots of hurdles to get over. Let's not drive out providers, especially in rural Minnesota. We don't have that many options. And so we have to be really careful that we don't set up a system that really is hard for them to achieve, and so then they want to drop out. Thank you.
And may Ms. Scheller answer the
Jacqueline.
question? Thank you.
Michelle, make it brief, and then we'll get to the testifier.
Thank you, Chair Noor. Thank you, Representative Murphy. I appreciate the comment. One of the things I did want to highlight is because of the nature of an assisted living not having an RN on site 24/7, they're on call. that precipitates quite a bit of what you're seeing here. When you have that on call and you have a policy that says, call the supervisor, figure something out, the delay in that can be very costly for the resident. So good points, but I wanted to point out, if we had another staff person, like in the nursing home setting, typically there's an RN on site 24/7, but nights and weekends, it's an RN on call. That's a big distinction in the assisted living environment that precipitates the need for some training for basic emergency care. Thank you.
Good morning. Welcome to the committee. Please introduce yourself and proceed with your testimony. Please keep it brief.
Yes, thank you. My name's Adrienne Sloan, and my father, Larry Thompson, was at an assisted living where he unfortunately passed away due to the no-lift policy and to the individual, the aide that was on staff that came into the dining area where he was at when he was trying to safely get to his mobilized scooter. And he ultimately, while he was trying to redirect himself, because he did fall while he was trying to get on the scooter, try to redirect himself, ultimately fell into the wall with his head pinned between the wall and his scooter. And there was an individual that was there working in the dining area that just looked and did try to, he did leave the room, and from the looks of it, was trying to find somebody to render aid. And during the 3 minutes that he was still alive, there wasn't a 911 call. There was an aide that came in, but continued to argue with some kitchen staff as to what to do. He was still breathing at that time in that compromised position. Ultimately, she directed the staff to leave, and she proceeded to scroll in her phone to try to find a phone number to call rather than 911 immediately. And during that time, in the video surveillance, we could watch him breathe and then die. And the gentleman the sheriff who came on site originally, he arrived within probably 30 seconds. And EMT 30 seconds later. But my dad was left in that position, not breathing, for 7 minutes after the woman entered the room. And so I'm here today in encouragement of the bill that is being presented so that nobody has to go through this tragic death like I did. My dad was a Vietnam veteran, a very proud Marine Corps veteran. Thank you. Sorry.
Thank you so much for your testimony. I'm really sorry about the tragic incident, and I hope we can all find a good solution to address this issue. So thank you so much. With that, Chair Schumer.
Thank you, Mr. Chair and Representative Cleavorn. Wondering on some of the changes that were made with the amendment there on the qualifications under 144E.27. Do registered nurses now qualify under that as they are now, or why the exchange there?
Chair Cleaver.
It is our understanding that they would.
Chair Schumer.
Thank you, Mr. Chair. With that, has there been any feedback from any of the other licensed professions that are a part of this? I know the recommendation came from EMS, and that makes sense that they would say, hey, get certified or get training like we get the training there. When I look at the National Registry of EMTs there's 20 board members there. Only one of them has a nursing background in that. And in this, we're asking for these other licensed types of nurses to get this EMT training. And so I'm just wondering if that's a larger conversation to have, or maybe you have been having that with other licensed care providers that are in the assisted living system now versus the EMTs.
Chair Cleaver.
Thank you. I believe the statement is not accurate, but I just want to verify that. I appreciate what you're bringing to I appreciate the concern you're bringing. Ms. Scheller?
Michelle.
Thank you, Chair Nor, Representative Schumacher. My understanding is that part of, again, the combination of the issues of not having an RN on site to make some of those decisions. So even regardless of training, I'm trying to get at the idea of the combination of circumstances warranting the request for the EMR training for someone on site. Because we're not asking them to be a licensed RN, the licensed RN may more quickly assess and determine do we need to call EMS, do we need to get the lift there? So I'm addressing the combination of circumstances that brings us to this point of saying if we're not going to have someone to be able to respond quickly with some assessment and training in that RN field, then we're asking someone to have some basic first aid to understand the emergency or to provide assistance in a non-emergency. So hopefully that answers some of your question.
Chair Schumacher.
Thank you, Mr. Chair. And so this would be for trained, unlicensed, and licensed staff equally, as long as there's not an RN on staff. It would be whether you have a medical license of some sort or certification. This would be in addition to that, as long as there wasn't an RN on site.
Chair Kleber.
The requirement that we are looking for is to have someone 24/7 on staff who can determine emergency, non-emergency, lift, no lift, right? We want to prevent harm if someone should not be lifted, and we want to prevent harm if someone should be lifted. And you referenced EMT, and I just want to make sure that the body is clear. It's EMR. So this is like the base level training.
Chair Schumacher.
Thank you, Mr. Chair and Chair Cleavorn for that. And we can talk offline about that. I just pulled that from the statute.
Perfect. Thank you.
From that, so whether it was a T or an R. Overall, and not in reference to this bill in particular, but just a general statement when we're talking about the difference between skilled nursing facilities and assisted livings and the transition from being able to live completely independently to the point where you need assistance around the clock. There needs to be transitions there, and I have concerns when we start to chip away at what the line between skilled nursing and assisted living overall. And again, that's not a comment on this bill in particular, but as with anything, we just kind of encroach into these other areas, and we talk about the expense of what it costs to be in an assisted living, and we continue to add other regulations, and it's all good-natured. It's all for the right purposes. But as we add on to that, the line between skilled nursing and assisted living gets more and more blurry, and that becomes just a problem, not for the type of care that's provided, but for the types of services that are available to the people in the state, especially at a time when we're getting older by the day. So thank you, Mr. Chair.
Thank you, Mr. Chair. For your closing remarks, Chair Kleber.
Thank you very much. And I think it's the blurriness that we're trying to clarify. When families move their loved one into assisted living, they need to know exactly what the policies and procedures will be. There is a tremendous cost that individuals pay in situations that we heard from Ms. Sloan. There is no denying that. And to just have an individual on staff who is trained in basic first aid in the EMR program, and to be able to distinguish emergency, non-emergency, I think is a pretty low bar. And I think that this entire bill is about raising awareness and protecting our Minnesotans. And so I appreciate your concerns about cost, but again, I will say that staff who are already employed can be trained. Maybe it will even elevate the workforce that would seek this certification so that they would be more employable. I think that would be a great thing too for people in greater Minnesota, but really it is about preventing injury and preventing harm for Minnesotans. And I appreciate your support.
Thank you, Chair Cleveland, and to all the testifiers. With that, I renew the motion that House File 3935 as amended be laid over. So the bill is laid over.